ladies and gentlemen. It is a great honor to be here today and I will be your moderator for this session. Let's talk health. Let me introduce myself first. My name is Saeed Al-Amri. I am a member of the Dhafra Youth Council and a caregiver at Zayed Hair Organization. The session will start, we'll talk in this session about how AI beginning used in healthcare and how to keep health information safe and how to make sure technology has helps everyone. First, we will start with Dr. Amin Al-Amiri from Ministry of Health. The question, Dr. Amin, in your opinion, what is the future of AI to building better health?
Thank you very much. First of all, it's my profound honor and my pleasure to be here, and thank you for inviting me to speak about one of the most important and valuable things in your life. It's not your wealth, it's your health. If you are healthy, you can do a lot of things. If you are not healthy, you can't do anything. AI in health is amazing, it's promising, and we are very much optimistic that AI could do and help a lot of patients in the world. And now, allow me to change the word, and instead of patients, we will say human being, because we in United Arab Emirates, our beautiful country, we meant to help the human being rather than to go to the patient only. And therefore, the name of our ministry has been changed from Ministry of Health to Ministry of Health and Prevention. Now, AI in UAE has been started a couple of years back. I will try to sort a couple of the programs which is being implemented and it's undergoing. Number one is the personalized medicine, that by the wearable items, your watches or any sort of application on your smart mobile, you will be able to do your vital sign and to be connected with your physician, with your hospital, and AI can analyze the data. And immediately, if there is any sort of abnormality, your physician can contact you. Secondly, the use of AI in prediction. Now, we gone beyond the prevention, we are into prediction. And what's the meaning of prediction in health? Prediction of health, that we take the data of a human being and we analyze those data and we find out within coming 10 to 20 years, what will happen with this guy? Is he exposed to any of the cancer diseases or genetic diseases or any of the non-communicable diseases? This will help us in helping the human being to give him the guidelines and to give him a support that he will be able to prevent this. We cannot say to stop, but at least to prolong. And instead of to get the disease in 5 years, we can be able to prolong to 15 years. Now, there are one of universities that are doing the study that they can take a sample of amniotic acid while the mother is pregnant, and they can do the test before the delivery and to predict which kind of diseases that this baby could get once he will be born. The third is the big data. The data is very important. And the more accuracy of the data you feed the AI, the best result you can get the AI. And unfortunately, if you will give a bad data to the AI, you will get for sure a bad result. The AI cannot recognize that. And therefore, now we are trying to make sure that the data of the patients to be analyzed and to find out where we stand in terms of the genetics, genetically, where the people they stand and what will be the actions to be taken for the future to protect the inhabitants of our beautiful country, the United Arab Emirates, from the different type of genetic disease. Fourth, we have been introduced during the Arab Health. I'm quite sure you know Arab Health is one of the biggest exhibitions worldwide, which it will be organized in Dubai every January. The technology, it's an iPad that you will stand in the front of iPad in 50 seconds only. The iPad could give you by the AI the result, your blood pressure, your pulse, your heart rate, your temperature, if you are happy or unhappy, and will give you your hemoglobin, your blood hemoglobin, the total cholesterol, and hemoglobin A1C for the sugar. 10 different test accuracies from 90 to 94%. Amazing. This will avoid the patient once he will go to the hospital, and instead of waiting for 1 day to do his blood test, the AI in 50 seconds will give you all the results. We are also working, and we introduced in Arab Health, the use of AI for the approval of the design of the hospitals and the health centers. And we have standards, national standards in the UAE. AI is the one to study instead of engineers, and AI is the one to tell for him, if he's an owner of a hospital, do the changes in operation theater, do the changes in the emergency unit, do the changes in here or there. And therefore, now we are trying to use, it's already under the initial implementation, the AI to design the hospitals and help the people. Finally, I can say the AI in helping the patients. I'll give you an example of myself. My father was admitted at the ICU for the last 3 months. A month later, we found a sort of complication on my father while he was taking one of the best antibiotics. I don't want to mention the name. And I was with the physicians. We meet once a day with all the physicians to discuss about his health. And this is the beauty of our health in UAE, that it's an integrative medicine. And we didn't know why these complications came to my father. I feed the AI with all data of my father and the illnesses and the medication he's taking. AI sorted out that a part of rare complication of this antibiotic is this type of complications. Immediately we stopped that antibiotic, we changed it to another one. The complication of my father has been disappeared in 2 days. Now, the use of AI in helping the patients, it's amazing, and this is what we are planning now to do for the future to be more enhanced. But the but, should be under the bracket. Now, if someone will feed the AI with wrong information or incomplete information, and then the result will be wrong. If any complication happen to the patient from the AI, now who's responsible? The doctor, the hospital, the AI, the management of the hospital, or the authority who allowed the AI to be used for that single patient? Here needs the governance, and this is the importance of this conference. The governance, although we have a lot of laws, regulations in AI in health, is being processed, and it's under the negotiation with the local and the federal and the private sector and academia. The academia involvement is very important. And therefore, the governance of health is very important once you would like to use the AI, and I'm quite sure I gave you an example of my father.
Doctor, what advice would you give to hospitals that are starting to use AI in their service?
Any of the hospitals, if you'd like to use the AI, they need to read the regulations and the laws in the United Arab Emirates. We've been ahead, like the NCEMA guy was saying, that how we planned for the future of UAE and how in advance we had the laws to help us, mainly in the COVID time. There is a law for medical liability, has been released in 2016. Article number 16 in this law protects the data of the patients, and the privacy of the patients and his data has to be well protected. And therefore, any hospitals would like to start, they need to read the law, they need to follow the law, and they need to go through the standards of United Arab Emirates. Secondly, there is an ICT law. ICT stands for Information Communication Technology. Is being released in 2019. It's law from His Highness the President of United Arab Emirates. And this law prohibits the use of the data of the human being, even with AI, unless if this data is being allowed by an individual patient, or he approves to do the research and development, or for the sake of his health, we needed this data to do a sort of analysis at the level of the country. And therefore, in our country, the protection of data is very strongly protected. The right of the patients has been very strongly advocated, and therefore, the governance of such data is very important, and we urge any single hospitals, whenever they would like to start, they have to go to the website of the ministry or the health authorities, which we are all connected together under one umbrella, and to make sure that they will stick to the laws and regulations to be able to implement the new technologies such as AI in health.
Thank you, Doctor. Now we're moving to Mr. Abhinav. The question is how we can protect data of patients while using AI in hospitals.
Yeah, thanks, Said. It's an honor to be here with such an esteemed panel. To be honest, like what His Excellency Dr. Amiri has already mentioned, that we have to be proactive when it's come to detecting the medical condition of a patient. That's how efficient we want to become. The same thing happened when we are storing or processing the data. Now you just imagine that your entire health data is residing on a server, which is getting utilized by multiple services, such as simple as a Philips machine, which is going to analyze the X-ray or the MRI machine. So these are very huge data, complex data. So at times we gave multiple system access to the same device. Now when we give the devices this access and we are not monitoring it properly, we are not monitoring the anomaly in the system, we might be exposing our patient data to the outside world as well. So it's very important that proactively we monitor what all is happening with the data, who all is accessing the data, where these data are processing, whosoever is processing the data is authorized to do so or no. So that is something very important. Plus, in the healthcare sector specifically, it has been increased, 180% cyber attack has increased on healthcare data. So there is lots of collaboration which is required. And I'm grateful to Ministry of Health. They are doing lots of efforts where they are pulling all the hospital, all the cybersecurity professionals together to counter the cyber attacks. So the collaboration is very important. And lastly, I will say, because there are so many legacy systems within the hospital that it's becoming an easier target. So we have to see as a cybersecurity professional or as a guidance by the Department of Health that how we can build a defense in layer. So it should not be like that if a hacker will be able to bypass one layer, they can directly hit the targets. So that's how I will say.
And another question, can you tell us about the process when using an AI in healthcare?
Yeah, see, just as doctor has already covered that it has to be proactive, and AI is helping us in detecting the medical condition faster.
Thank you so much. Thank you for both, all of you. And the AI is changing the future of healthcare, but as we heard today, it's important to use it carefully, protecting people, following the rules, and making sure it's fair for everyone. Thank you again, and I hope you enjoyed the rest of this session. Thank you so much.
Thank you.